Our final speaker it's an absolute pleasure to introduce Wendy, who's not only a colleague but is a real pal. So, and Wendy is Director of Nursing at FCMS PDS and is also the Safeguarding Lead at FCMS and PDS. And he's going to do a call for action. Thank you.
Okay, you can all hear me? Where's the clicker? Okay, so it's an honour to come today and speak to you all, and to have all of you here. I couldn't believe how many people, wanted to come to our conference, and we're thrilled to bits. And the great thing is, there will be more. We've had fabulous speakers, and I've just been amazed by what they've brought to us and the information that they've given to us. And you sort of think, you're in the know, you know quite a lot, but actually you feel quite humbled because you realise you only know a small proportion of it all. We listen to people tell the stories, personal stories about being abused as a child. I mean, where do you get the energy to do that from? But it's really great to listen to the likes of Kenny tell us about, reform. It's going to happen and it's happening. So that's really great. So I wanted to say really from here is, so what? So what now? What do we do after today? Do we just come here and sit on our butts all day long and then go home, nothing changes? Well, not for us. Okay. Ian spoke about the key organisational questions that you need to ask about your own organisation. Are you ready for safeguarding? Are you ready for these big cases that are out there? How well equipped are you to deal with big safeguarding incidents or even singular cases? And what tools do you have available to yourself? And do you have the knowledge of what to do? So I thought about that question, and I thought about how we can get around that. And as I've been safeguarding lead for 20 years with the organisation, which sounds great, and I think I'm only it because nobody else wants to do it. So, but now I am in that position. What I want to make sure is that we're doing the best we can. And I want to make sure that hopefully nothing passes our doorstep or we don't miss opportunities. And I'm sure we do, but we need to be trying actively not to. And I was at a conference this summer and I saw that, it's not hidden, you're not looking. I thought, flipping heck, that's right. We don't look, we don't, Mark said this morning, we don't ask the question, have you been abused? Is somebody hurting you? When did that happen? We don't, because we're scared of the answers, I'm sure. So what have I learnt about myself? Well, I've learnt that in 20 years of safeguarding, that we as an organisation, we can't be doing that good. We can't not have had all these cases come through our doors. Blackpool has got its massive set of poverty, social problems, the toxic trio. It's out there all the time. And I can't believe we haven't got one of those incidents like in Rotherham and all the other towns. I think it's just we've not seen it. And I think it's coming, and I hope that if it's out there, that we don't miss it and we don't find out about it, that they've passed through all our services without us doing something, because I'll be gutted if it has. So one of the things I want to talk to you today is how we can change, how we can get excited about safeguarding, how we can make sure that we're ready for those changes in our institutions, organisations, as described by Ian. So one of the ways we can do it is quite subtle and it's very simple really, is we develop communities of practice. Now Kenny mentioned this earlier today, and I think if he'd have stole my thunder I'd have been quite glad really, but he didn't. But it's true, we can do community of practice. Basically, a community of practice is just groups of people who share a concern, a passions about something. So what we're doing in our organisation is we're going to bring safeguarding leads from each area of practice together, and we're hoping that will bring some enthusiasm and some support to them.
Okay, a community of practice. So this is what it's made of. It's a domain. So if we look here again, going back, so we've got a domain, a shared interest that connects the members of the group. Within that community, then we can do activities. We can address, are we ready? Do we have the right tools? Do we have the right support? Does anybody listen to us? So we can do all that. So practice, the members of the community are practitioners. And now, interestingly, when I was reading about this, it said it was all about healthcare professionals, and I'm not sure about that, because do we all need to be healthcare professionals? And what's a professional? So that's just something to challenge the group. We started in December, our group, and I'm really looking forward to it. So what do we hope to actually get from this group? Well, I thought the brilliant thing that's been brought up again and again today is we've got to look after our staff. We can't allow them to be given the burden and the worry and go away and think nothing's happening. So we've got to safeguard our safeguarders. And we've got to make sure we give them time to do that. We need to have time for them to reflect. And I want to ask them, when we get into our groups, is to ask each person why we don't look and what are the barriers to stop people looking. And I think if we give people time, they may tell us the answer. I can only talk about my own experience, but I think each person will have had their own experience of dealing with a safeguarding case. We talked earlier about public health practitioners. That's what we are now, and that's what we're all moving towards. It's not just about plasters and diabetes. It's about the whole thing, the whole social health, finance, everything together. And to really help people, you can't just deal with the safeguarding. You've got to deal with the whole person. I think it'll be great to listen to other people's experience and to encourage people to share their knowledge. I'm not the expert. We are a group of healthcare professionals who can learn a lot from each other. We can talk about sharing good practice. What does good practice look like? So we're trying to do a lot of work within the organisation to say, what does good look like? And I think at the moment, we've still quite a chunk of work to do on that. I think asking our staff, what does good look like? I've just written a piece about what does good look like with regards to safeguarding. That's just me. That's no good. I don't work at all the different sites. So I need to get all the practitioners together and ask them, and then they can then support them to help them deliver good practice within their area. And with doing that, we'll help the person grow. Each person within the room, they can just personally and professionally develop. Okay. So really that's community of practice in a nutshell. There's a lot to it. I would ask you all to think about that. Think about if you could use that in your own area. Not just for safeguarding, for lots of other different things, but just bringing together those people and giving them time to learn and reflect. So I also want you to think about these words, and they're not my words, they were words from Kenny today. He said, above all, what I want you to get from today is listen. Listen to people. With the listening, it came asking that question. Ask the other question. Dig a bit deeper. The next thing you need to really do is believe, because if those of you watched the drama the other night about the girl who was trafficked in, the big thing was nobody believed her. The Rotherham girls, nobody believed them for months and months and months. And it's a resounding thing. People have often been to our services, they've told us about issues, the blank face, nobody believes them, and it's a common theme. So with safeguarding, the big safeguarding word is never do nothing. And I do a lot of training across our organisation, and I often leave it with never do nothing. But I think now I'm going to add a bit on saying do something.
Thank you.